Hello student. Today we are going to learn about the blood pressure and hypertension. Human body and organ system. This chapter is going on and the today's topic is blood pressure and hypertension. You studied that heart is a blood pumping organ. Hence, blood is continuously kept flowing under pressure. This pressure is actually exerted where heart contracts. When blood flows through under enough pressure, it reaches all the organs. The pressure exerted by hearts or on contraction is high and it is called systolic pressure, and that one exerted when heart is relaxed, it's called diastolic pressure. For a healthy pressure, blood pressure ranges from about 120 by amount mm to 139 by 89 mm of mercury. Have you ever seen a doctor measuring a blood pressure of any patient? The equipment using blood pressure is sphygmomanometers. Sometimes if a person is fat or obese, the blood pressure may be high. Remember, if the blood pressure is always beyond 140 by 90 mm of mercury most of the time, then this condition is called hypertension. Hypertension is different from diseases like fever, cold or malaria, etc. Hypertension must be treated properly, otherwise it may be very dangerous. Hypertension risk of breaking or rupturing of walls of arteries is increases. Thus, the blood supply to a particular organ gets affected. Hence, hypertension must not be ignored, and one should take doctor's advice for the same. Summary: the pressures exerted by heart on contraction is high and it is called systolic pressure, and that one exerted when heart is relaxed is called diastolic pressure. The equipment used to measure is blood pressure is sphygmomanometer. If the blood pressure is always beyond 140 by 90 mm of mercury most of the times, then this condition is known as hypertension. Hypertension must not be ignored and one should take doctor's advice for the same. I suggest a small activity for you. Check blood pressure of all adults from your family. Keep it records. If you find the someone blood pressure is high than or normal, take him or her to doctor.